All right, this is a continuation of the first video. Section 3, supportive therapy. This therapy will help you manage your anxiety by restoring and improving your ego function, self-esteem, and adaptive skills.
Okay.
So during this session, when you first, during the interview with you, when you first came for therapy, you told me that you are experiencing increased pressure from family, education, your relationship with others, including your roommate. Do the problems affect your self-esteem and your confidence?
Yeah, they definitely do, especially for my family. Since I'm the oldest of five, I feel like I always have to be the best all the time and set a really good example. And since my parents do come from a strict Nigerian background, they really stress the importance of education on me, and it can really get overwhelming because sometimes I feel like the grades that I'm producing aren't good enough for them, and it puts me on edge all the time, constantly, and I feel it affecting my relationships with others as well because I've been having a hard time not only with my roommate but just making friends in general, and I just feel like my confidence and self-esteem it's definitely not where it needs to be. I have developed doubts about my abilities to do well in school, as far as getting good grades, also with relating with people, and just the overall concept of just my well-being and trying to be successful.
I want you to know that this is a safe place and we're here to help you, and I'm glad you can open up and talk about your feelings. I understand how this can help and affect the way you feel about yourself, but I want to encourage you today that you are not alone. You already took the biggest step by identifying you have a problem, and now together we can discuss how we can resolve them. What do you enjoy doing? What usually relaxes you?
Well, typically, I like to go to the gym and exercise. My favorite class to take is kickboxing. It can be really empowering. I also like to dance. My favorite type of dance is hip hop dance. Playing basketball, open gym. I also really do like to draw. Drawing does relieve my stress from time to time, and when I do have the money, I like to go shopping as well.
When was the last time you did any of these things for yourself?
It's been years, to be honest, especially since I started college. The class overload can just be so much that I feel like between going to college and studying to make good grades, I just never really have time for myself anymore.
Okay. I want you to schedule some time to do these things that you usually enjoy, that make you happy. Exercise is good. It helps you lose weight, you feel good, you do good. Overall, it helps us improve our self-esteem. Go dancing. Like you said, you love to dance. Play some ball in a basketball court like you used to. Do some retail therapy. Buy things for yourself. These things will go a long way in helping you rebuild your self-confidence.
Okay, well, do you think if I'm able to deal with that, I'll be able to fix my issues such as education, my financial situation, and my poor relationship with friends and family members?
Oh yes, gradually. You will improve your self-esteem, your ego functions, your adaptive skills, and as a result, you'll be able to overcome issues related to education, your relationship with your family members, and your roommates. Okay? This method is suitable in dealing with the connection between personal problems and anxiety.
Yeah, okay, thank you. I actually really do miss dancing and exercising especially, so I think after this session, I'm about to go sign up for a gym.
Oh, that sounds great. Now, section 4, interpersonal psychotherapy. So in today's therapy, the focus is your relationship with your family members and your roommate.
Yes.
So during the interview, you reported family pressures regarding expectations that have strained your relationship with your family. You also stated that your stressors are affecting your relationship with your roommate.
Yes, they are.
How does that make you feel?
Well, since I'm always having pressure from my family, it always just makes me worried and on edge, and I just never feel like I'm able to do well or be good enough. And with that, it affects my relationship with my roommate because I feel like I'm always taking it out on her. Like there was this one time, I was really close to my friend, but I wasn't anymore. I don't tell her anything because I feel like she just can't relate to anything, and it really hurts that I've just fallen apart. Like I really do miss our relationship because we did used to be close, but ever since my relationship with my family is starting to get strained, it's just kind of hard to like connect with her. But like I really do miss her, and I just don't know how I can make it better.
I hear the pain in your voice. It's possible to rebuild your relationship with your family and your roommate one day at a time. I believe addressing your anxiety, like we had discussed in the previous sessions, will put you in a better position to rebuild what you had before. For example, your family. You can plan to go home more often and spend time with them. You had previously mentioned that your mom invites you to come home, but you decline. Find time to spend some time with family, sharing meals, doing chores, hanging out with your siblings, attending family functions. These are some ways you can reconnect with them. Spend time with your mom and your dad. For your roommate, I'm confident that she'll be pleased that you do something with her. She must also miss your friendship too. You can start with a dinner or a movie, but don't forget, it's just one day at a time.
Okay. Yeah, thank you. I'm definitely willing to try. I really do miss how things used to be. I love my family. I love my siblings, and I miss my friendship, and I want to make things better. So, yeah, thank you. I'm going to do it.
Oh, I believe you're going to do very well. I wish you all the best. Thank you so much for coming in. I hope everything works out for you and have a wonderful evening.
Thank you so much for this. I appreciate it.
You're very welcome. So the expected overall encounter. The expected encounter involves Mimi getting the required help to address the problem of anxiety. By seeking therapy, the patient will acquire the coping skills necessary to identify her triggers, manage her symptoms, and reduce her anxiety in this case. The treatment approaches will help the patient to deal with inaccurate and distorted emotional response, self-esteem, and interpersonal relationships with the family members. The only challenge in this case is time. We are unable to follow up with her to reassess the effectiveness of the psychotherapeutic approaches that have been implemented today. How do modalities can be used to support cultural diversity? Mimi is an African American student whose first encounter with psychiatry is of recent. Based on evidence, the CBT, IPT, and supportive therapy are suitable for her situation because they are sensitive to and support different cultures and diversity among patients. African Americans are not opposed to using therapy to treat mental illness, so these approaches will be beneficial to her. The therapies utilized will help in her changing a pattern of thinking, improve her adaptive skills, and promote interpersonal relationships. In summary, psychotherapy approaches are effective in the treatment of different mental disorders affecting people in our communities. Psychotherapists have realized that a combination of different psychotherapeutic approaches should be used to treat psychiatric disorders effectively. In Mimi's case today, the patient is affected by anxiety that is characterized by cognitive, emotional, and behavioral problems that lead to a feeling of fear, uneasiness, worry, and strained relationships. CBT, IPT, and supportive therapy are appropriate in her case to help her manage and cope better with her symptoms. Implementations of these therapies will enable Mimi to address all her symptoms, reduce anxiety, help her sleep better, and improve her grades and her relationship with her family and her roommate. Thank you so much to Mimi for consenting to do this video. I hope you enjoy watching it as much as we did recording it. Thank you and have a good evening.